Your last A1C was 5.3%. Your fasting glucose was 94 milligrams per deciliter. Your doctor told you your blood sugar is perfect. What your doctor didn't see, the glucose spiked to 162. You had 2 hours after your Tuesday lunch. The nocturnal variability from the wine you had Wednesday night. The fact that your healthy oatmeal breakfast is doing more glycemic damage than a candy bar might. A1C and fasting glucose are backward-looking, average reporting, completely blind to the daily patterns that determine where your metabolic health is heading. Continuous glucose monitors fix that, and they're not just for diabetics anymore. I'm Dr. Trevor Turner, founder of Pravida Health in Atlanta, where we focus on longevity medicine for entrepreneurs and executives. One of the tools I use most commonly, and that patients find most immediately eye-opening, is a month-long CGM protocol. In 2024, the FDA approved over-the-counter CGMs for people without diabetes. That decision reflects a growing body of evidence. Glucose variability in metabolically healthy people is clinically meaningful, and you cannot see it with a once-a-year blood draw. Let me show you what a month of CGM data actually reveals. Here's the fundamental problem with standard glucose testing. Fasting glucose captures one data point, what your glucose is after 8 hours without food, in the morning, before any metabolic stress. A1C gives you a 3-month average. Neither tells you what happens when you eat, work, travel, or stress. And what happens in those gaps matters enormously. Glycemic variability, how much your glucose swings throughout the day, has been independently associated with cardiovascular risk markers, even in people without diabetes. Two people with identical fasting glucose and identical A1C can have completely different variability profiles, one metabolically stable, one running spikes and crashes all day long. The research shows that even in normotensive individuals, higher glycemic variability correlates with higher blood pressure variability, a surrogate cardiovascular risk marker. For the typical entrepreneur, intermittent fasting in the morning, a quick lunch grab between meetings, afternoon stress spike before a board call, 2 glasses of wine at dinner, a late night snack, the CGM curve looks nothing like the perfectly normal snapshot on the annual lab report. And by the time your A1C creeps up to 5.7%, the prediabetes threshold, you've likely had elevated postprandial glucose for years. A 2025 systematic review analyzed 7 studies of CGM use in non-diabetic populations, over 1,100 total participants. The conclusion: CGM in non-diabetics is useful for personalizing lifestyle interventions, motivating behavior change, and identifying at-risk metabolic phenotypes before traditional diagnostics catch them. Here are some of the specific findings that I find most clinically actionable. Food-specific responses. A 2025 controlled clinical trial tracked healthy adults wearing CGMs through standardized dietary challenges. High carbohydrate meals drove average glucose to 161 milligrams per deciliter. That's a significant excursion, and completely invisible to a fasting glucose test. But here's what was interesting. Individual responses varied substantially with identical meals. Your glucose response to a bowl of white rice is not the same as your colleague's glucose response to that same bowl of white rice. CGM makes that individual variation visible for the first time. Exercise type matters. The same study found that aerobic exercise kept glucose flat, actively blunting postprandial spikes. Anaerobic, high-intensity exercise? The glucose curve looked like a meal. Your cortisol and adrenaline response to intense exercise transiently raises glucose, independent of what you're eating. That doesn't mean you should stop lifting weights. It means you should time your hardest training sessions appropriately relative to meals and understand that the glucose spike you see post-hit is normal physiology, not insulin resistance. Exercise timing. One of the most actionable CGM findings, walking before a meal. Specifically, walking in the 20-minute window before your anticipated glucose peak reduced 4-hour postprandial insulin levels by nearly 29% in one controlled study. That's not a supplement. That's a 20-minute walk, precisely timed. Stress and sleep. Psychological stress elevated glucose significantly in the CGM HYPE study. And anyone who's looked at their glucose around a difficult work call or before a presentation has seen this. Cortisol raises glucose as part of the normal stress response. Over time, repeated cortisol-driven glucose spikes are part of the metabolic cost of chronic work stress. When I use CGM clinically, I'm looking for specific patterns. Postprandial peaks above 140 milligrams per deciliter, especially if they're sustained for 30 minutes or more, or if they happen consistently with foods the patient considers healthy. High coefficient of variation, a statistical measure of glucose variability. I want CV below 36% in non-diabetics. Higher than that, and we talk about dietary modification. Nocturnal patterns. Is glucose rising in the early morning before breakfast? That's the dawn effect, and an amplified version suggests early insulin resistance. Recovery time. How long does it take glucose to return to baseline after a meal? Longer recovery times are a marker of impaired glucose clearance. I had a 44-year-old executive come in last year. No diabetes, normal A1C, but she felt energy crashes mid-afternoon, had trouble sleeping, and had gained 12 pounds over 3 years despite no major dietary changes. Her CGM told us immediately. She was spiking to 155 to 165 milligrams per deciliter after lunch daily, with a subsequent crash to 72 that left her reaching for a coffee or a snack by 3 p.m., which reset the cycle. We changed her lunch sequencing. Vegetables and protein first, carbohydrates last. We added a 15-minute post-lunch walk. Glucose peak dropped by roughly 30 points within a week. Mid-afternoon crashes resolved. She described it as her body suddenly making sense for the first time. That's what real-time feedback does. It makes the abstract specific. If you're tracking your metabolic health with an annual fasting glucose and A1C, you're tracking history, not biology. CGM shows you what's actually happening. Our signature membership at Pravida Health includes 1 month of CGM with clinical interpretation built in. Not just the data, but what to do with it. Link is in the description below. Subscribe for evidence-based longevity content every week. I'm Dr. Trevor Turner at Pravida Health.